Before you scroll past this, answer one question honestly. Is there a spot on your body that's been itching for weeks with no rash, no bug bite, no explanation, and you've just been ignoring it? Because what I'm about to tell you might change how you see that itch. There are 3 specific places on the human body where persistent, unexplained itching isn't random. It's not just dry skin, even though that's what almost everyone assumes. In each of these 3 locations, that itch can be one of the earliest, quietest signals your body sends out, sometimes weeks or months before anything shows up on a routine blood test. Most people never connect the dots. Most doctors, in a rushed 15-minute visit, never go looking for the connection either. And by the time it's obvious, the window to catch things early has often already closed. I'm not here to scare you. I'm here to make sure you don't ignore something your body might already be trying to tell you. Stick with me, because the third one, the one almost nobody expects, is the one I most want you to remember. Let's go through all 3, starting with the one most people get wrong. Place number 3, the lower legs. Specifically, itching below the knee, your shins and ankles, that keeps coming back, especially at night, and doesn't fully go away with lotion. Here's why this matters. Your lower legs sit at the very end of your circulatory system. If blood flow starts to slow down as you age, those far-out capillaries are the first to feel it. Fluid can pool, tissue can become oxygen-starved, and the nerve endings in your skin respond the only way they know how, by itching. This is a well-known early sign that doctors associate with poor circulation and early peripheral artery disease. If you've had unexplained lower leg itching for more than a few weeks, especially with any swelling or skin discoloration, it's worth asking your doctor for a simple circulation check. It's called an ankle brachial index test, and it's quick and painless. Place number 2, between the shoulder blades and along the rib cage. A lot of people assume this is laundry detergent or dry skin, and sometimes it is. But persistent itching here, especially when it feels like it's coming from underneath the skin rather than on the surface, is something doctors keep an eye on too. The skin and several internal organs, including the liver, share nerve pathways, which is part of why problems with bile flow or liver function can sometimes show up as itching somewhere other than where you'd expect. This kind of itch tends not to respond much to scratching, which is actually a useful clue. If this sounds like you, a basic liver panel is a simple blood test that can rule a lot of this out. And now, the one that surprises almost everyone: the palms of your hands and the soles of your feet. Itching here with no rash, no dryness, and no obvious trigger, especially if it's worse at night, is one of the most specific signals doctors look for. Your palms and soles are packed with an unusually high concentration of nerve endings that are extremely sensitive to changes in your bloodstream. When the kidneys aren't filtering as efficiently as they should, or when bile acids build up due to liver issues, these nerve endings are often among the first in your entire body to notice, sometimes well before standard blood work shows anything abnormal. This is genuinely one of the reasons doctors take palm and sole itching seriously, even when everything else looks normal. If this describes you, and it's lasted more than a few weeks, here's exactly what to bring up at your next appointment. Ask for a basic metabolic panel to check kidney function, a liver panel, and if it's been going on a while, a thyroid panel as well. These are standard, inexpensive tests. You are not being dramatic by asking for them. You are simply paying attention to your own body, which is one of the smartest things you can do as you get older. There's also a lot you can do starting today that supports all 3 of these systems at once. Staying well hydrated helps your kidneys do their job more efficiently. Regular movement, even a daily walk, supports circulation and helps your liver and kidneys keep up with filtering your blood. And if you're noticing any of these symptoms, it's worth cutting back on alcohol, since it puts extra strain on a liver that may already be working harder than it should. Here's the honest truth: most of the time, itching is just itching. But your body doesn't usually send the same signal, in the same place, night after night, for no reason. So how do you know when an itch is just an itch, versus something worth checking out? Itching that comes and goes with the seasons, responds well to lotion, and shows up alongside dry or flaky skin is usually exactly what it looks like: dry skin. But itching that's persistent, doesn't fully respond to moisturizer, is worse at night, and shows up with no visible rash is the kind of pattern doctors pay closer attention to. None of these signs alone is a diagnosis, but together they're worth mentioning to your doctor by name, rather than brushing it off as, "I've just been a little itchy lately." If you've experienced persistent itching in any of these 3 spots, your lower legs, your upper back, or your palms and soles, write it down. Note how long it's lasted, what time of day it's worst, and whether you've noticed anything else alongside it, like swelling, fatigue, or changes in your skin color. Bring that note with you to your next appointment. A specific documented symptom is far more useful to a doctor than "I've been a little itchy lately." If this helped you, or made you think of someone who needs to hear it, share it with them. And if you're new here, welcome to True Age Wellness. Subscribe, because every week we break down what your body is actually trying to tell you in plain language, without the scare tactics. Take care of yourself. I'll see you in the next one.